Alors, bonjour à tous.
Hello, everyone, dear colleagues, ladies and gentlemen. Welcome to this press conference to go over the situation in Quebec about COVID-19. The Deputy Premier of Quebec and Minister of Public Safety, Ms. Geneviève Guilbault, is together with the Minister of Health and Social Services, Ms. Danielle McCann, and the National Director of Public Health of Quebec, Dr. Horatia Arruda. Madam Deputy Premier. Thank you very much, and hello, everyone. So I am going to start, as usual, with the numbers of the past day. So as of today, we have 79 new deaths for a total of 1,761 deaths. Of course, my thoughts, all of our thoughts of the entire team are with the family and loved ones of those families who have died. A total now of 26,594 confirmed cases, an increase of 837. 1,648 people hospitalized, an increase of 23, of which 222 people in ICU. That is an increase of 5 people compared to yesterday. I want to get back to the situation of the staff in CHSLDs, in the residences for the elderly. As you know, for many days now, about a week or even 2 weeks now, we've been getting a lot of reinforcements following the numerous calls that were launched by the Premier. And this is continuing, this reinforcement. And today we can be happy of the announcement of the arrival of about 400 military personnel who will be arriving in Quebec, who should be arriving in Quebec. A part has already arrived to come and help out in our residences for the elderly. This is going to be added to the troops who have already been deployed since the 20th of April from the Canadian Armed Forces. So we thank them. We are very happy of the arrival of these people that will allow us to add people in 8 new CHSLDs that were designated in collaboration, of course, with the people from the Ministry of Health and the Canadian Armed Forces. So 8 new CHSLDs added to the 5 where there were already members of the Canadian Armed Forces working. So these 8 places are the Centre de Soins Prolongés Grace Dark, the Reine-Élisabeth CHSLD, Résidence Bertillon du Tremblay, Vigie de Mont-Royal CHSLD, des Floralie de la Salle CHSLD, le Centre d'hébergement Saint-Laurent, Argyle CHSLD, and Benjamin Victor Rousselot CHSLD. So these 8 new places where members of the Canadian Armed Forces will be able to go help out. This is very good news. I said that the arrival of these new people, it remains that we still have huge needs in our residences for the elderly. Therefore, anybody who has the ability and the possibility and the willingness to go and help out, we invite them to do so through the Je Contribue website. Your help will be welcome. It remains our national emergency. The quality and giving out of care to our elderly in our residences for the elderly. As we said over the past few days, we have succeeded altogether to flatten that curve of contagion through our efforts and our respect of the guidelines of public health for now 2 months. And this is what allowed us this week to reopen our gradual reopening of daycare and schools the day before yesterday, and yesterday the gradual reopening of certain commercial activities. And today, to go with a new announcement today of gradual reopening of our regions. So all of that is possible thanks to our discipline. And we should not see in this step of deconfinement, which is very gradual, a synonym for going more easily in terms of guidelines. So everything that we are announcing in certain sectors of activities in our society, despite this, we continue going along and complying with the guidelines of public health. We continue maintaining the 2-meter distance and of washing our hands and obeying all guidelines, because that is what makes it possible for us to go forward with the opening. The key ingredient for the gradual reopening, whether it be daycares, school, economies, or the regions, as we will be announcing today, is to maintain the exceptional discipline that Quebecers have really been following for now close to 2 months. If we should see that the contagion curve starts going up again, if the prediction should become somber again, if there's a deterioration in the conditions, we will push back and delay some reopenings. So it's important to understand that all of these plans depend on the discipline that we'll continue submitting ourselves to. But Quebecers have been exemplary since the beginning, and I continue asking them to continue being obedient and to follow the guidelines, despite the announcements of gradual reopening that have been made in these past 3 days. So it is within that logic of gradual reopening that today we're announcing a reopening plan, still gradual, of certain regions of Quebec. The idea is to progressively decrease or even withdraw police controls or roadblocks from certain regions, certain places that were closed, if you will, up to today, to allow people to move around between those regions, inside or outside of these regions, to be able to follow with this reopening plan of the economy. We are still asking Quebecers to avoid moving around if they don't have to go from one region to another. If it's not essential, I've said it, we have to continue to follow the same guidelines, and avoiding superfluous movements between different regions is part of those guidelines that we are asking Quebecers to respect. It is not time to go have a walk or to go visit other stores or grocery stores others than the one that are close to our home just for fun. We should avoid moving around. We should stay around the area where we live, where we are, and to limit our moving around, although they are becoming allowed for certain regions. And so as of next Monday, the 4th of May, we are going to progressively reopen under reserve, and if it continues to go well, certain regions. So as of Monday, the 4th of May, the roadblocks will be removed for the Laurentians, the Lanaudière region, Chaudière-Appalaches, and for the city of Rouen. That is for Monday, the 4th of May. If everything still keeps going well, Monday, the 11th of May, we will withdraw roadblocks in the Outaouais region with the exception of Gatineau. So in the rest of the Outaouais, in the Abitibi region, Latsuc, and the Saguenay-Lac-Saint-Jean region. And finally, the following Monday, which would be the 18th of May, if everything keeps going well, the regions in the Bas-Saint-Laurent, the Gaspésie, Île-de-la-Madeleine, the Charlevoix sector, and the Côte-Nord will also be reopened to be able to move around. As far as the city of Gatineau is considered, the north of Quebec, the Basse-Côte-Nord, Mangani, Nunavik, and the Cree lands of James Bay, which were also territories that were being controlled right now, we are not able today to give you a date for those sectors because we are still evaluating the situation and follow it in those places, in those communities. So we cannot give you a date today, but of course, with public health, we're following that very closely. And as soon as it is possible to give you a date for those sectors, we will do so. The idea is to not open prematurely, to continue protecting those sectors that need to be protected, and that is what we are doing today by not giving right away a date for those places, but as soon as it is possible, we will be doing so. The reason why we are announcing as of today this calendar that could change depending on the evolution of the situation is to allow people to get ready with the fact that these sectors will be reopening, to get ready for the people that could perhaps be more fearful, to prepare themselves to the fact that this sector, this area will reopen, or the opposite, people who are impatient to see their area reopen. It'll give them an indication of when it will happen. So that they know that the sector where they live or work, where it will be allowed once again to move around. So we will continue evaluating the situation, as I said, but the key word really is discipline in that entire plan of progressive reopening of the regions of Quebec. Just as in, for the economy, the schools and daycares, it depends on the capacity and willingness of Quebecers to continue applying the public health guidelines. So we have to maintain social distancing. We have to maintain the prohibitions that are in place right now in terms of public health. So stay 2 meters away. We have to continue washing our hands frequently. We have to continue protecting our more vulnerable people, amongst them our elderly. And we have to continue avoiding, I said it, any unnecessary movement between regions, and we have to avoid gathering. gatherings, whether it be inside or outside, they are still prohibited, and it's important to say so. So all these guidelines remain, despite the reopening of certain sectors. But evidently, in parallel with the reopening of certain sectors of the economy and certain commercial and professional activities, it will generate more moving, going, and coming, going. And so it was the logical follow-up to go with the gradual reopening of regions, certain regions of Quebec. So if all this is successful, if we are prudent, if we are docile, and if we are disciplined, we are going to succeed with this reopening plan of the regions, and just as we'll succeed with the other reopening plans in Quebec without relaunching the pandemic. So that is the objective, relaunching Quebec without relaunching the pandemic. And it is together with these guidelines of public health that will succeed. For our daily thanks, I want to thank our teenagers who are home right now and who, for many of them, were very disappointed to learn that they won't be able to go back to school. Or maybe not go back to school as such, but they won't be able to see their friends, that they won't be able to see their school, that they won't be able to see their teachers before the end of the school year. We know that it's a disappointment for you, so I want to thank you, despite the fact that you are disappointed, that you understand the situation and to comply with it. It's very appreciated. Thank you for your discipline. And I also wish to tell you that we've heard you and that right now we are working with the Ministry of Education to find a way of, making sure that your graduation won't go without being seen, especially for the ones that are receiving, the graduates that are receiving their diploma, because unfortunately they won't be able to have their traditional ball. So we're thinking about you to find a creative way of replacing the prom, but respecting the guidelines. So we would like to be able to allow you to really put an emphasis on that important moment in your life, that is graduation from high school. Thank you to you. You're working really hard. You are, we're working very hard to be able to offer you a privilege or something despite the present context. I would like to finish by saying that we're going forward, we're progressing, but it's not time to say that we've reached victory. We say it often, it's important to say so. The problem, the virus, none of that is behind us. Yes, we are re-announcing, gradual reopenings, and we are considering reopenings, but everything is not over. And I want to keep saying it. It will depend on our discipline and it will depend on our efforts of social distancing and if we maintain them. So I encourage you to continue. I ask you to continue respecting the public health guidelines. We've been exemplary in the past 2 months in confinement. We have to be just as exemplary in the gradual reopening of Quebec. I thank you. A few words in English.
Good afternoon. I first want to address the staffing situation in residences for the elderly. We have already received a lot of reinforcements and more are coming. Today, we announced that we will add 400 militaries in 8 CHSLDs. This is good news, but we continue to ask for help. As we said in the past few days, outside of the CHSLDs, we have managed to flatten the contagion curve. But the key ingredient to the gradual reopening is to maintain the exceptional discipline that Quebecers have shown for almost 2 months. Prudence remains our watchword. It is in this logic that we are presenting today a plan for the gradual reopening of some of our regions. But we still ask Quebecers to continue to avoid unnecessary trips. Now is not the time to rush to shops outside your region. Unless necessary, you are asked to stay in the area where you are. We are announcing this calendar to allow people to prepare, but nothing prevents it from changing if the situation deteriorates. So we are making progress, but now is not the time to declare victory. Now is not the time to stop all our efforts of social distancing. We've been exemplary in the confinement phase. Let's continue on that path for the gradual reopening. Thank you.
Merci, Madame la Vice-Première.
Thank you, Madame Deputy Premier. We will now start with the question period. Hello, ladies. Dr. Arruda. Dr. Arruda, my question is for you. Right now, there is an outbreak at the Maisonneuve-Rosemont Hospital, as well as other hospital centers. Might that make you delay this reopening in Montreal? Well, many factors could make us delay it, and perhaps for the question period of the hospital centers, the minister could complete, because I'm more with public health and the organization of services as such. But of course, the capacity for treatment has to be there in the hospital centers, because it is clear that in deconfining people, we already know, we'll probably have cases. So ideally, not too many deaths. That is what we wish, especially in people who are at risk. So there has to be a control in care centers and health centers, but also in community centers and environments. But the situation is relatively under control. There's been outbreaks, particularly in certain centers that don't necessarily have the same care structure. But perhaps I will let Madam Minister, I don't know if you want to complete. Well, what I would say on that, and we've been saying it for many days, that the situation in the Greater Montreal, the metropolitan area, it is different than the rest of Quebec, and we have to take that into account. And in the deconfinement measures, we spoke of a week later. And of course, we will be reviewing it. Public health is going to be reviewing the situation. Montreal remains a hot sector. There's the situation in CHSLDs. And as our Deputy Premier was saying, we are seeing an improvement with the staffing availability, thanks to everybody who has come to help us out. And je contribue. But we have not yet won the battle. We really have to stabilize our establishments more, our CHSLDs, and that is what we're working on right now. As far as the hospital sector is concerned, I want to reassure HMR that the HMR hospital, that the oncology sector, all those important sectors are continuing. But right now, at that hospital, we can't go further with surgery. So we said that we're going to increase the volume by 50%. We'll find other venues. But what we're doing as well is that there are people who are no longer in active care who are in our hospitals, including HMR. And now we are doing an entire operation to bring those people into other safe sites. We've done a lot of work on this in the sense of having dedicated teams, cold zones, hot zones, sufficient protective equipment, so that will help. And it has to be said as well that the Maisonneuve-Rosemont Hospital, which is very close to Montreal Nord, and we know that there is a situation in that area with outbreaks, but also it's a hospital that receives a lot of people and the emergency ward. So there are patients who have arrived, patients with COVID-19, and so therefore there's a big volume of COVID-19 patients. There's 165 right now that are being hospitalized for COVID-19, but the outbreak, we've taken control over the outbreak and we continue with our urgent activities, the ones that are urgent and necessary at the hospital. And I will end by saying that we will be reviewing in the entire island of Montreal the hospital sector, and we'll see, because there's a lot of help amongst hospitals, if there are things that we can do elsewhere than at the Maisonneuve-Rosemont Hospital, well, that would be good. Because what we're doing at the hospital right now, we believe that we'll be able to increase surgeries, for example, and other treatments that are not urgent, but that are more elective, and that we'll be able to increase them as of next week. So we are taking control over the situation. With the reopening of the regions, since the beginning, since we put ourselves on pause, and the rest of the world as well, if we decompartmentalize regions like Charlevoix, Gaspésie, Bas-Saint-Laurent, and Saguenay, and there isn't a health network that is huge, isn't there a risk that we will be losing control? Well, I'm going to let Dr. Arruda take the mic, but what I can tell you is that we have been following from day to day that curve, but we're also following the hospitalizations in general and in ICU, and we can see that there is a stabilization as far as hospitalizations and intensive care. The numbers that we give you already includes people who have COVID-19 but that don't need the technical plateau of the hospital. So we have to make that difference, because if we look Yes, but for all the regions, the numbers that we are giving you is really for the entire regions of Quebec. And the hospitalizations and intensive care, 2/3 of those people were hospitalized and got intensive care in the greater Montreal region. So we are not concerned so much for the other regions as we are for the Montreal region right now. But on the question of the epidemiology, I would like to give the mic to Dr. Arruda. But we did do preparations in the other regions of Quebec who don't have the same volume. We understand that. But, of course, we're going to have to follow the situation very closely. Dr. Arruda? And just very quickly, I would just like to mention that those regions are going to be reopening last as well. We're talking about the 18th of May right now, and it's provided that everything goes well. In the meantime, Dr. Arruda and his team are going to be following everything. And if we have to modify dates consequently, if there's an upsurge of the curve or a situation that would deteriorate, we'll do so. And it's important to repeat it. These plans are predictions. They're plans, but it's only if things keep going well by the date where we're planning. And it's clear that beyond the epidemiology of Quebec, we have an analysis that is made for the region of Montreal that by category, communities, CHSLDs, etc. So we go more finely. And we're going to make sure that we have the same criteria for the deconfinement within the cold regions. That is to say that we make sure that there's enough tests, that there's the ability to conduct inquiries as such, and that there is leeway in hospitals to be able to do so. So I think that those regions probably have the better conditions. We hope that they're not going to experience the same phenomena as what happened in CHSLDs in the metropolitan area. First, because probability of the smaller populations, less contacts. Secondly, they are preparing themselves in terms of human resources in order to not have the problems that we ended up having. And there's PPEs more than before. So I think that once again, it's still going to keep being monitored from day to day. But I do believe that it is if there's one place where we can let things go a little bit more, I think it is in the regions outside of the metropolitan area of Montreal. The question has been talked about in the past few days, but when we reopen the regions like right now, what should Quebecers anticipate for this summer in the sense that we know that there will probably not be international travel? Tourism is important in Quebec. If the curve, if things go well, if the optimistic scenarios are successful, is your objective to allow and encourage Quebecers to travel between the regions? And according to you, would you be able to evaluate the evolution of the curve? When would you be able to do so, if so, in order to be able to announce whether traveling will be announced in the regions? Well, maybe a general word, and maybe Arruda can complete if he wishes. But yes, of course, we do wish that people can go back to a normal life. Eventually, we can't answer right now when that will take place, when we can see our parents, our grandparents, our friends. And there will be segmentation. Of course, the most vulnerable group, like our elderly, are probably going to have longer protective measures than other groups, like for children who are already going back to school. So that really is a situation that is evolving from one day to the next, from one week to the next. This week, we've already announced very significant reopenings, schools, daycares, certain aspects of the economy, and today certain regions. It's one step in that direction. And you mentioned it. There's a potential touristic opportunity that is incredible in the constraints that we're experiencing right now. But it's not going to be tomorrow morning, as that Pierre Fitzgibbon was saying, my colleague lately. It's not tomorrow morning that we're going to go drink a pina colada in Mexico. So there's a tourist opportunity in Quebec. Certainly we're going to want to seize it, but when we're ready to do so. Right now, everything that is non-essential, the rentals, cottages, traveling in Quebec, that is forbidden right now. It's not possible. Once it is possible, not only will we be happy to be able to make it possible, but we'll even be encouraging Quebecers, to purchase locally, all of that. So there are opportunities that are going to stem from this, but right now, I've said so, we cannot, things are not behind us. We haven't reached victory. We can't tell, on the 4th of July, you can make a reservation for hotel in Gaspésie to go see the Rocher-Percé see. Right now, we can't do that. But certainly, we are working towards that. We are conscious of the fact that people are starting to get tired. Sometimes their spirits goes down and things, the weather is getting beautiful. It makes us want to go out and visit. We want to be able to give that right to people as soon as it's possible. But right now, apart from what we've announced this week, which is already a huge step, we can't give the impression that we want to reopen everything and allow everything at once. We don't want to encourage people to not follow the public health guidelines. That's a really important message. If there's one message I want to be understood today, yes, we want to reopen and we want people to keep at a distance and unfortunately to avoid visits to our parents and grandparents in the residences, to wash your hands, avoid gatherings, and all that. But yes, that's what we're wishing for, and we look forward to Quebecers being able to have a normal life. But it's going to be months yet before we have a life like before the pandemic. If you'll allow me, I think it has to be understood that the progressive deconfinement that we are going through, it is to allow for commercial activities, life activities to take place. It's not an invitation to travel. And if ever we redo it, as long as we don't have a vaccine, it's going to be a different way of camping. For example, not many families around the same fire. For example, we're going to have to do things differently. And as the Deputy Premier said so well, it is truly something that is going to have to be evaluated from one day to the next. And you have to understand that in the same way that, we had essential workers for the health, for emergencies and all that, and police officers, firefighters, now we are reopening one element. It doesn't prevent you from staying in regions, but it doesn't mean that because we're removing barriers that it means that everybody's going to go from one contaminated area to go to another area that isn't, and then you end up contaminating that. That's not how we should interpret this. It's very important. We said it yesterday. You have to respect the guidelines that are given. And in the same way, if there was an important inflow of people from a hot zone, where there's still active transmission towards cold zones, well, we're going to have to put up roadblocks again. And that's not what we want to do. So we're inviting you to take advantage of a certain level of freedom associated to this deconfinement, but as much as possible, do stay around where you are right now and avoid gatherings. Perhaps they will take place clandestinely. We suspect that human behavior that happened in France might happen here. But it's not inviting because it's for yourself. It's for your own health, and especially that of our elderly. And we had to take that into consideration. But as soon as we're able to do so, we'll tell you. But as I said, we don't have a vaccine. We don't necessarily have a treatment yet either. We don't know what's going to happen. It's possible that the virus will slow down over the summer. Is it going to become even stronger in the fall? We don't know. Mr. Arruda, these past few weeks, you talked a lot about mental health. You explained, for example, the reopening of schools for that reason, that it's good that children be able to find a more regular life. We're talking about children here, but earlier on, Ms. Guilbault, you called to Quebecers' docility to respect the guidelines. But why is getting together not allowed if you stay 2 meters away and you're outside? Do you think that for the summer we'll succeed doing it? We can understand inside, closed off areas can be more dangerous for the transmission of the virus, but I imagine Quebecers who have a backyard, for example, who can have chairs 2 meters away from one another and have a barbecue. Could they do that this summer? Well, listen, nothing is excluded, but I can't tell you now because I really want to see what the deconfinements of the 4th, the 11th, and the 18th or later will lead to. Because human behavior, how could I say this? We always have good reasons to not feel that we are at risk. And the 2 meters is not always respected. But listen, we are the first to also want to be able to live and experience those moments again. We miss our friends. The barbecue outside, we miss it. But I think that we have to go step by step. But I want to give hope. We'll not be able to anyway, stay closed up completely, but we have to dose the risk and see really what's going to happen. Next question. Ms. Guilbault, I was wondering whether this also holds for the border between Ottawa and Outaouais on the 11th of May. Is the SQ going to withdraw, or the roadblocks, are they going to be withdrawn? Well, the roadblocks are, random on the 5 bridges that Quebec and Ontario are sharing. They're going to be maintained because Gatineau is in a category to maintain later, but there are other points of contact with Ontario that exist. The border with Ontario has never been officially closed. It's important to, bring that clarification. There was surveillance brought. We wanted to avoid non-essential moving around. And as of the 11th of May, yes, there will be, but there wasn't necessarily systematic surveillance between the other points of contact between the Outaouais and Ontario. So we can't give the impression that the border was closed and will reopen. We do maintain those of Gatineau because there's a very high volume, and there was concern taking into account the situation in Ontario. So we've put all of that and considered it, and this will allow people moving around within the municipalities in the Gatineau area. And there's good reasons to do so, so that is a decision that was taken. Ms. McCann, what is the situation of the young handicapped people who live in CHSLDs? Do they think that they might be able to go out soon? Because they're not people who are 60 and over. That's a good question, and we're very sensitive to that situation of the people with a handicap, the young, but even people who are not as young. And I think that disabled people have to follow the same guidelines since they are in the same residence. We don't want there to be contamination. But I reiterate, I would like to take advantage to say how the government wants to change things for disabled people in CHSLDs, for example. And that is why we started working on alternative homes and alternative environments. We're 3 ministers working on that, Madame Blais, Mr. Carman, and myself. I even have a parliamentary assistant, Madame Picard, who is working a lot on that. So in parallel, because, we still have another year of experiencing, of living with this virus without a vaccine, so we will continue working for the people who are disabled and live in CHSLDs because we want there to be alternatives for those people, sincerely. Ms. McCann, I know that you have to be, reassuring, but in the case of both hospitals where there are outbreaks in Montreal, people are a lot more worried than you seem to be. The occupation rate in Montreal hospitals is increasing. There's a scarcity of staff. People are concerned. You recognize that you made a mistake with CHSLDs. You dropped the ball. What guarantees us that you're not going to drop the ball on hospitals? I think that what can be said is that we're faced with a new virus that we didn't know, and we are adjusting ourselves often because we discover new things having to do with this virus, for example, contagion by asymptomatic people. So that was a very important factor in our CHSLDs, and now we're making epidemiological inquiries in our hospitals in Sacré-Cœur and Maisonneuve-Rosemont Hospital. What happened? Measures are being taken right now to contain the outbreaks. There are truly very important measures that are being taken, and public health is doing and conducting its inquiry. All urgent activities are maintained. Of course, it's concerning. Of course, this Montreal situation is worrying. We have to say it clearly. What helps is that we see that the people that we've called out to Anja Contribue, they do call a lot, and we should be able to add a lot of staff in Montreal because that's where we have the most needs. And that is what is going to make a difference amongst other things. And there's fewer people who are absent from the network right now. There is something, I hope that today we'll be able to tell you that we are starting to perhaps see an improvement. You can see that I'm being very prudent because Montreal is concerning. Montreal Nord concerns us. The Maisonneuve-Rosemont Hospital as well. But we're doing everything that we can to control the situation, and we are controlling it. We have controlled it at Sacré-Cœur as well. Of course, these are 2 hospitals that are very old. They're obsolete. They have infrastructures that are more difficult to manage in the case of a pandemic. But I do believe that all the measures are taken. But yes, I want to reassure to a certain point, but that does not mean that I'm not worried. And what I want to tell the population is that everything that we can do, we are doing, and we are improving our processes. We are adjusting ourselves to this virus. We are discovering it gradually, but also we're adding staff. We are improving the organization of our work. We want to continue with the services, and the services not only for people who are infected with COVID-19, but all the other people who have been waiting, for example, for an intervention for a whole month, and now they have to have that intervention because there are health problems where we must act after 4 weeks. And that is what we are going to be doing in Montreal and the rest of Quebec. At the Maisonneuve-Rosemont Hospital, was it a good idea to mandate that hospital, one of the most dilapidated in Quebec, to be able to, for the COVID-19 patients? Well, I think that we had to use all of our hospitals. We had to free a certain number of beds. We had to have a certain number of COVID-19 beds that were available. We put everywhere. We really used all of our resources, all the hospital centers that were necessary, and everybody had to participate. You remember that we started with the Jewish General Hospital, and then we opened Sacré-Cœur, HMR, the CUSUM, the CHUM, I'm probably forgetting one. We opened all the hospital centers that we could because we needed all of those beds. What is interesting now is that if we remove the people who are in a hospital sector but who could be elsewhere, who have COVID-19, we see that the hospitalization rate is stabilizing as well as intensive care. So we hope that we have reached a plateau and that it's going to start decreasing beyond just stabilizing, that it will be decreasing. But in fact, we had to bring to bear all of the Montreal hospitals. Otherwise, we wouldn't have had the available beds in regular hospitalization as well as intensive care.
Bonjour, Madame la Vice-Première ministre, Madame la Ministre, Monsieur Arruda.
I would like to know, with that perspective of a problem that is pretty marked in Montreal, have you thought of taking people who are hospitalized right now in, for example, Centre Maisonneuve-Rosemont, etc., to send them towards sectors that are not as affected, in regions where there's fewer outbreaks, to try to have a less important, significant concentration of people affected by COVID in the same place? Is that being considered? It's being done. We sent patients in the Suroît. We sent some to Charlevoix, to Pierre-Boucher as well. They took patients from Montreal. So that is a solution that did come a few days ago because we could see that there was, there was going to be a bottleneck. There was too many people. And also because people are coming back, and that's good news throughout all this. We were saying not long ago, don't wait. We were telling people, come to the emergency. If you have a problem, call your doctors. And I think that people heard that message. And also because it's time now. When you've waited for a month, but basically you shouldn't be waiting any longer, you have to come to the emergency ward if you need it, or you have to call. And that is what people are doing. And we want to reopen surgery. So we have already asked these hospitals of the Montérégie region to come and help. And that is what they did. And I wish to end, because, emergency wards are very busy right now in Montreal. I want to tell the population, do not hesitate to call a family doctor, whether they be your family doctor. Call them if you have a need. Don't go to the emergency ward if it's not urgent. Call your doctor or call a clinic in your neighborhood. You will be answered. Family doctors are available right now to be able to answer you. And I invite the population, and there's going to be more sustained communications on the part of the Federation of Generalist Doctors on that, as well as the Ministry of Health and Social Services. So I make the same call out for people to start calling their family doctors. Dr. Arruda, taking into account what is happening in Montreal, what we've been talking about for a few minutes now, for you, could it question the deconfinement plan for the Montreal region? The answer wasn't very clear earlier on. Are you thinking of saying, well, the plan that we presented to you this week, things are not going well in Montreal, so we might delay by a week or two. We could question it entirely. It's a possibility. I think that we have to look, as I said, what the data is going to show us. And for the Montreal region, especially in the northern east area of Montreal, there's more, finer inquiries that are going to be done, as well as tests to better document the situation, to see where we are in or at and what that might mean. Right now, I won't keep it from you that the hot zones are relatively stable in their elements. There are zones that are increasing, others that are decreasing, but it's going to take, a more advanced epidemiological inquiry and analysis to be able to look at the population in the different sectors. And it's clear that this could call it into question, but that's what we said. It's going to depend on the data that we have, more specifically on that. And the hot zone right now in Montreal is going to be intensively investigated over the next few days. My question is to Dr. Arruda. What is your evaluation of the risk of the number of cases in the regions that we're going to be deconfining with the removal of roadblocks? Do you have projections or statistics that might allow you to say, well, we estimate that there's going to be an increase because we are removing roadblocks? Well, the scenarios are being calculated, and you have to understand that we have to have pretty recent data to be able to project them. Because, long-term projections, the further you go, the bigger are the gaps. So it's almost not worth doing it anymore. So, of course, we are going to try to remain below 1 for the RO. That's going to be an indicator that we're going to try to have. That is, to have a curve that could go up a little bit, but not exponentially. And that will depend on the capacity of the territory to absorb a certain number of cases. At some point, it will also depend how many days it takes to double the number of cases. All of these analyses that are going to be made. But since the virus probably hasn't circulated a lot in what we call the cold zones, there are places where there's been no cases in 3 or 4 weeks or so. Well, that means that the virus is probably not very present. Now the question is, if it gets reintroduced, how would we be able to control it and investigate it? Don't forget that it means that, if there's a case, I'll take the region where there's no cases, in the Bas Saint-Laurent. Let's say that there's an outbreak or one case, we're going to intervene very quickly to be able to put it out right away without necessarily for it to have impacts. Like most people don't necessarily have complications, and will be asking the elderly to also protect themselves. The sanitary health impact should be lesser, but we do have to plan for it. We're going to be following that very closely, all of those regions in the hospital sectors and CHSLDs, but the advantage for the regions that we are deconfining, and I'll say it this way, is that they've learned from the Montreal example, the greater Montreal area, because Montreal and the greater area, was taken a little bit by surprise. The spring break and the density of the population. We reviewed all of our protocols within the health network and social services. So the regions that were less affected learned and set up those protocols, those new measures to protect themselves. And we have planned for a certain capacity. But of course, we are counting on the population to, of course, keep to the same guidelines, comply with the same guidelines, because if we were to see that there is an upsurge that is significant, we would be forced to close everything down again, as we've often said. Now, if you'll allow me, a question for Dr. Arruda once again. What was mentioned often in the last few weeks is contacts between generations. Switzerland is reviewing its position right now. It estimates that it is now safe for children, young children, to be able to hug their grandparents, because it's often something that we've talked about in the media. The director in the division, Dr. Daniel Koch, says that scientists have shown that young children do not transmit the virus. Could your position be revised with these studies or Swiss analyses? Yes, I know Dr. Koch, and the WHO, and I would say that there's other authors in Australia, for example, that have been publishing that element. Unlike what we have in cases like influenza, where children are generators, like incubators of germs that transmit a lot, here it would probably be less significant. We're going to be keeping an eye on that very closely with our scientists. We do want to have a certain assurance of that before, saying that it's okay. But we're very conscious that if it's a case, and we're also going to be seeing it with the deconfinement as well, where we will be people in contact with the daycares and stuff. We'll see what's going to happen with transmissions, because we're going to be testing as well on those populations to see what the transmission is in family and others. So that will allow us to document in the Quebec terrain what is happening. But of course, we can see that there's evidence that there's little risk, and if so, we might be able to do it adequately.
Oui, bonjour à tous. Une question pour Madame Guilbault.
A question for Ms. Guilbault. I heard what you said about external gatherings, you and Mr. Arruda. But in the decree on the state of health emergency, we can read, forbidden all gatherings except external gatherings if a minimal distance of 2 meters is maintained for people who are gathered. So just to be clear, in virtue of the decree, if we organize a barbecue on a private, backyard, people who are getting gathered there might receive a fine? Well, strictly speaking, when we look at the decree, what we're saying is to avoid as much as possible to gather. In an ideal world, apart from the people with whom you live traditionally, your immediate family, avoid seeing other people or allowing other people to come into your home or to go to other people's homes. But if you have to see people outside, we'll keep a 2-meter distance. So what we're telling people is avoid as much as possible inviting people over to your place. But if for all sorts of reasons you end up with people, you have to be 2 meters away, outside as well. But I won't lie to you. In my street, it was beautiful the last few days. I often take a walk, with my stroller, and I see people. Somebody's in the street, somebody's in their garage. They're 2 meters away, they're chatting. So they're respecting the guidelines, and they can sometimes be more than 2 because everybody has their own 2 children. People, accumulate, but they all keep a distance except for the immediate family. So that's possible. It's possible to go out for a walk and take some fresh air. We said it, but you have to respect the guidelines. Earlier, I said it. You have to keep in mind that it's exciting and, it's seductive to see reopening plans such as this. It makes us want to take advantage of it for a long time. But to be able to take advantage of it and to, take a step back and change our minds in certain aspects, we have to maintain social distancing and hygiene and washing hands. And we have to follow those guidelines. We have to be prudent and we have to go gradually. Those are the words of the day. It's been transposed in the plan that we announced Monday, yesterday's plan, and today's plan as well. And also, we absolutely ask people to follow the guidelines of public health, like social distancing, to avoid us having to go backward so that we can continue going forward with what we are, this is a starting step. And if you allow me, walking 2 meters away or being in a garage, is different than ending up around a table at a meal where there's handling of objects and things like that. And often, we have a tendency to forget that you are 2 meters away or that you're supposed to be 2 meters away. It's easy to say, but in a context where you're having a meal, you have the idea of, the man and a woman at a very long table with the chandelier in the middle, but that's not how people end up. People end up around a table, closer, they manipulate the same objects. So, yeah, that also is one of the factors for which we are being prudent about this. But, if we are able to get through this certain steps and an epidemiological situation where there isn't so much circulation, well, these are activities that we will, of course, want to see taken up again, but still with prudence during that period. A meal is not the same thing as walking with somebody or speaking with somebody in the street. Since merchandise transportation was already allowed, and it's not an invitation to go traveling to remove the roadblocks, and we can't see our parents or gather inside, what's the use of today's announcement, removing the roadblocks that we're announcing today? Well, I talked about it earlier on as being the logical, follow-up to Monday's and Tuesday's announcements. And I don't know if I said so, but of course, as we reopen certain professional and commercial activities, for example, the construction sector that is going to open, all the retail, the manufacturing, all of that is going to bring extra movings and goings in the regions that are right now closed off. because there's roadblocks. So at some point, it would also become unmanageable. People have to be able to move around as we allow certain things. And it also goes with the mind of the gradual reopening of Quebec. I said it, prudence, and we have to go, with a certain level of gradation. And public health remains our imperative, but we've been preparing people to the fact that we will be making early announcements to reopen certain aspects of Quebec, and this week we did it. Monday with the schools and daycares, the economy yesterday and today really is the logical follow-up, even if it's only to allow those movings around, which will be allowed in the framework of the other plans. But it's redundant, but it is... These are not promises, it's subject to the fact that people are going to continue respecting the guidelines and that we won't need to withdraw the privilege that we want to give to Quebecers of being able to, taste a little bit of normalcy. Last question in French. Hello, Mr. Arruda. You said a bit earlier on, we'll see what will happen in terms of transmission with the opening of daycares and schools. You also said ideally there won't be too many deaths. You're telling us that your scenarios are being elaborated, so they're not in between your hands now. No, I didn't say that they were being elaborated. I'm sorry to interrupt you. You can finish your question. Well, in the context, how are you going to convince Quebecers that you are not making experiences by using them like guinea pigs? Well, listen, people, first of all, I have to say I am the National Director of Public Health. But sometimes I'm being accused of being also, a deputy minister and to have these pressures. But no, I am not experimenting or wanting to experiment things with people. You have to understand that health is not just infectious diseases. It is also, a state of mental health and others. And when we have too much confinement at some point, we can have reactions of violence and all sorts. So we have to take that into consideration. We try to balance it out. The people that we're asking to normal life will come back with completely different conditions, even if it's just the ratio, the distance, and etc. And you'll say, well, it's difficult to maintain a distance of 2 meters between young children, but we are going to increase the ability to do so. We are allowing people to have contacts because of the epidemiology that we have right now that are at much lesser risk than others of having complications. And we are asking people who may have complications to not do so. And it's not a lab here. It's, trying to come back to the most normal life as possible while minimizing the risk. And delaying all this to the month of September, October, November, when we have the flu and other infectious diseases, it won't be better. However, and I've said it, everything is conditional. If we realize that in the metropolitan area it's too early to do so because we don't have the indicators that we need, that there's a level of transmission that is too active in the community, well, we'll make the necessary decisions. When I was talking about scenarios earlier on, of course, the scenarios have to introduce data that are not present. For models to work, it's the weekends data that are going to be treated on Monday that require 24 hours being entered into computers and that are going to give us graphs as we published at the National Institute of Public Health. We have projections, but we can only put in proportions. We have calculations. We follow the ROs as the data evolves, and I can tell you that the RO is below 1 in the regions where we are going to be applying to confinement. For the Montreal region, we were a little bit below 1 at the last scenario. We'll see now. So that is, it's not experimentation. And very important, people are doing it, voluntarily. Whether it's schools or daycare, I certainly do not want to test things out on children. It is quite simply to allow them. There's even young people who are calling us in high school who would have liked to have been able to go back to school. So there's different positions. Not everybody thinks the same way. We're happy that it's not mandatory, and we are truly going to act as, good good family members and transparent with the information that we're giving you. In the regions that you are reopening, there's a few Native communities. How are you working with them? What are the rules that are going to be applicable? We have been working very closely with the communities in question. And if you see the regions that are in the to-be-determined category for which there is no planned date for the reopening for the time being, those regions have many of those communities. We know that many sometimes are a little bit more vulnerable, not as well equipped to be able to deal with the situation. That is the reason why we have called out to the Canadian Armed Forces. We have rangers that are supporting the Ministry of Health in certain of those communities in the Basse-Côte-Nord and in Nunavik. So we are working very closely with them and have been since the beginning. We are adapting ourselves to the reality. For the time being, they are not in the deconfinement plan, many of them. And for the regions, or at the very least, we don't have dates. But for the regions for which we already have a date within and where there are Aboriginal communities, well, that was evaluated like everything else, and we judged that they are able to deal with the reopening of the borders. I mean, it's not really borders, but, the regional limits that we're talking about. But, of course, we are adapting ourselves. We are giving them necessary resources. We're working closely with all communities, whether they be considered vulnerable or not. So, Aboriginal communities are certainly part of that. We now have to go to the English questions.
And we'll start with Samuel Pouliot, CTV News.
Hi, Mrs. Guilbault. We're getting questions from some business owners who are wondering when they will be allowed to reopen, like barbershops, hair salons, gym owners, and others. When will the government have a timetable for them to reopen?
Those businesses are closed as we speak, and we are not in a position to give a specific date for that kind of business. We already announced yesterday our plan for some types of businesses, as you know, so detail stores and construction and other types of businesses, but we are not in a position as we speak to give dates for those kind of businesses, because if we talk about hairstylists, those are people who work really close to their customers, so we have to evaluate this situation, of course, with our good Dr. Arruda, who might be willing to add something about that.
Yes, in fact, we would like to give the people the right date and make sure it happens that way. But as we have to control also the issues related to the protection because of distancing issues, even if we can find some things, we also have to control how many people get into circulation in a place. So it's why they are going to be later. I hope as soon as possible, and when we're going to go through, I would say, those first phases, and we're going to be in control of the situation, we will also probably project some dates.
Okay,
Quickly,
and Dr. Arruda, do we have data to explain where transmission is happening in the community? Not within families or travelers, but how much spread is happening in stores or outside? Like people walking.
There is some. We know that it has been almost driven at the beginning by travelers, after in, I would say, healthcare settings like CSSLDs, and probably even some workers from there went into their communities and been infecting the community. Like if what you're looking in Montreal North, actually, there is a lot of staff of workers come infected from probably their work where there was, I would say, outbreaks. But we are going to be now, as we are going to open things, make some more tests in different settings and be more able to calculate what is exactly the transmission in the community.
Cathy Sonnet, CBC.
Good afternoon. Mrs. Guilbault, you said we are reopening some gates, some regions gradually, but you ask Quebecers to stay disciplined, as if this is a taste of freedom, but stay still, stay obedient. What are your expectations from Quebecers after being in isolation for several weeks? How do you want them to understand your announcement today?
Well, Quebecers have been exemplary. They have had such a discipline from the beginning. That's why we are able today to announce this gradual and cautious reopening of economy, of schools, of services éducatifs, and today of regions. But to be able to maintain those projections and those plans that we have, Quebecers have to remain very careful and have to obey the directives from the national health, because if they don't, we might see an upgrade of the curve that we wanted to flatten, that we have been able to flatten. But if we see that the situation is deteriorating and that the curves has another update, we will have maybe to postpone some reopening, and we don't want that. So if you want stores and regions and schools to reopen as we planned that they would, comply with the directives, and we should be able to go on with the plan as we announced them this week.
But what do you say to Quebecers with the next regions reopening, like in the next coming weeks? If I want to go to do my grocery store in a different region, what do you say?
We still have to avoid unnecessary going from a region to another. So just because the region is reopened and that there is no more control of the moving, you must not go in those regions if you don't have a good reason to go, because we don't want people to go in another region to maybe get the virus there if it's not there already. So we don't want people to go from one region to another if they don't have a good reason to. We want people to keep up washing their hands, to stay at 2 meters from distance from other people, to keep protecting our vulnerable people, including our seniors. So we have to maintain those rules. It is important to be able to go ahead with the plan, with all the plan that we have for the reopening of Quebec.
Thank you. So the next question is from Philippe, Montreal Gazette. It's for Minister McCann. We are seeing Montreal hospitals cancelling surgeries. Hospital and ERs are now overcrowded. You have many beds occupied by people who cannot be moved back to CHSLDs. Is the situation under control?
Well, we're moving on the people who are in the hospital that can be moved elsewhere. Some emergencies, not all emergencies, are experiencing more overflow, and that's linked to probably the fact that they don't have enough beds for people to go into those beds because they have people that should be elsewhere than in the hospital. So we are moving on that. And at this point, there's only one hospital who canceled surgeries today, and it's Maisonneuve-Rosemont. The other hospitals are going ahead. We have a plan to increase to 50% of our capacity surgery. For Maisonneuve-Rosemont, we will reorganize in the next few days, and we think that next week they will be able to increase their surgery. But again, all urgent surgeries, oncology, cardiac, everything is being done as it has been since the beginning, but we want to increase the capacity. And all the treatment that are becoming necessary are being done at this point in the network in Montreal.
The next question is also for you and Mr. Arruda. Can you please update us on the situation in Montreal CSHLDs? We would like an update on the number of jobs which have been filed. How many employees do you still need? How many residents have COVID-19 now? Do you think things are under control?
Well, again, we want to be very careful when we say this because we want to be sure. But what we can say today is that we still have a lot of people who are away from work, but we have a little bit less today in our network and in Montreal, a little bit less. We have also have done a lot of work on the CHSLD, the long-term facilities. And with the Army coming in, and with also all the people that have called us on Je Contribue, we had thousands of people calling us, and we have hired thousands of people. It's getting a bit better. We're not over the situation, far from there at this point, but we see a small improvement. So what I'm saying is that I hope that next week I'll be able to tell you that there is a significant improvement in our CHSLD in Montreal. But people are working very, very hard, and I want to salute really again the workers, because this situation has changed completely the way people are working in CHSLD and in hospitals. It's been a very, very demanding situation. But again, we're getting more people in, and we are seeing a slight improvement.
Thank you. Dr. Arruda, you want to add something real quickly?
The deaths, and I would say most of them are still in CHSLDs, but we are seeing the curve is going down, actually. Even if there is the same numbers every day, sometimes the cases that have been dying 4 or 5 days ago because of the system. So I hope that situation is going to go down, continue to go down. So I think by the end of the week, probably we will confirm that really the number of deaths per day is going down significantly, de façon significative. I'm sorry for that term.
All right, thank you. So quickly, 2 last questions from Raquel Fletcher, Global News. For Minister McCann, we continue to hear stories about staffing and PPE shortage in CHSLDs, about staff moving between institutions, about institutions without hot and cold zones, about limited or no access for caregivers. Do you have an update on the situation in CHSLDs? A little bit the same question.
Well, we're opening up access for caregivers, definitely. We have reviewed the question with Dr. Arruda and with Minister Blais, and we are opening up more. And as the situation in long-term facilities will improve, especially in Montreal, we will open up more, obviously. But we're opening up right now. And again, there's staff coming in, more staff from Je Contribue, from the Army, from education. We had some physicians helping us. So the situation is slightly improved, and we hope it's going to get better day after day.
Thank you. And real quickly for Dr. Arruda, many restaurants owners are wondering if they should just go bankrupt now or wait to see if they can open this summer. What can you tell them about when you think it will be safe to open?
It's a good question. I would say I know that our Prime Minister yesterday told them to make sure they contact their banks or Development Economic to help them to survive. I understand the crisis. I understand the way they must feel for that, but everything will be depending on what is going to happen in the next days, week. And so I would just encourage them to not do banquet right now, if possible. Try to have some help, I would say, from your banks that should be comprehensive, but also there is discussion between banks and the government. And so it's what my Prime Minister told yesterday, and it's not my field, but make sure that I love restaurants. I want to go back to restaurants, and I hope as soon as we're going to be able to do that, we will.
And in the meantime, if I might add, just remind them that we announced measures to help all small businesses, including restaurants, so they can, if they have liquidity issues, they can use the program, the Programme d'action concertée temporaire pour les travailleurs of $2.5 billion. And they can ask for, we announced $150 million through MRC, so they can make a request to have for a loan that less than $50,000. So there are measures to help them in the meantime, but of course, as soon as we can allow them to reopen, we will.
Merci. Alors, c'est ce qui conclut pour cette conférence de presse. Merci.
This puts an end to our press conference. Thank you for being available longer than we usually make these things go on. See you tomorrow.